Hi, this is Jen Rubin from The Contrarian. It's my great pleasure to have with us today Dr. Julie Sweetland. She is an expert in issues of medical disinformation and other public health issues. Welcome to the program, Julie.
Thanks so much for having me. It's a pleasure to be here.
So tell us briefly what your area of expertise is. What do you help us understand?
I'm a sociolinguist, which means I study the intersection between language and culture. And I specifically look at how small differences in language match up to big issues in the world. And I work at a think tank called the Frameworks Institute. We're a group of social scientists from across the disciplines. And so I draw on my colleagues' research in anthropology, political science, sociology as well.
That's fascinating. Well, it's a timely area of expertise, shall we say, right now. We've had a crisis of medical disinformation made worse by COVID. How does medical disinformation get started and spread? And what's the ultimate impact on people's behavior?
Yeah, so I think this is one place where the distinction between misinformation and disinformation can be helpful. Some unsound, unsupported ideas about health simply just come from our culture, from our grandma, right? We believe that we need to put a scarf around us to prevent the cold air from making us sick, and cold air does not make us sick, right? It's just kind of a leftover idea from an older way of understanding how disease happens. But disinformation is when people know something isn't true and they are advancing that idea publicly and repeatedly for some sort of personal, financial, or political gain. So it really is an effortful approach to sharing bad ideas. The reasons for that, right, are as varied as the disinformation itself. So when we see disinformation about the safe and effective drugs that can allow women to terminate a pregnancy at home, when disinformation about that starts going, right, often we see the motivations are really about wanting to control women's reproductive health overall. So that's one type of motivation. Sometimes the motivation is personal power or prestige. So if you are asking provocative questions, right, about things that people were a little suspicious or unknowledgeable about to begin with, often that can give that purveyor of disinformation some cachet, a following, some of that prestige.
Often people who are engaged in this say you can't believe anything that the scientists or the medical professionals say because they're always changing their mind. You hear this a lot. That seems to misunderstand how medical research and science progresses over time. Talk to us a little bit about that canard and what the response should be for people who genuinely may be confused about changes in the state of medical research or best practices.
Oh, that's a good one. I'm so glad you asked about that. In the research that we did on how Americans understand science and social science and research, we ended up calling that mental model of how that science is fickle, or as new study every week, right? This sense that they used to tell us chocolate was bad for you, now it's good for you. Is it bad? Often it's these sorts of things that are, again, science seen as fickle. I think part of what drives that perception is actually media coverage of
Yeah.
scientific papers, right? So, and it's not to say any one journalist is acting out of bad faith, right? They're looking for what's new, what's different. That makes it newsworthy. That's why they cover it. But the cumulative effect, right, of covering the change and what's new and different can lead to that perception that science is being fickle. One of the ways when we work with scientists to kind of work through that is to help is to counsel scientists to tell more of a story about the study. So what was the puzzle you were trying to solve? What motivated this study that even had you digging into this? What was the process that you took to follow that, to study that? What did you control for? What assumptions did people think that you ruled out, and how? And then talk about the findings, and then what that means for the future. And that kind of narrative arc is very different than our traditional scientific papers, but also the way science gets covered in a large part in the mass media. But what it can help us, what can help ordinary Americans do is break through that assumption that my observation is the same as scientific inquiry, and really understand that it's different. Because most people, when they say do your research, we need to research something, they're actually thinking about looking up consumer information on the internet, right? It's accessing information that already exists, which is very different than the scientific process of producing new knowledge, right, in a systematic way, and actually trying to check and make sure that what we assumed was always true, is it really true? We sometimes find that it isn't. That's natural for the process of inquiry. So I think there's some scientific literacy to be built there, but that it can be done in a fairly effective and simple way.
Do the omnipresent advertisements on television and other media for drugs, and also the easy access on the internet to all kinds of information, complicate the problem? Do people have the sense that they really know what's best and they may be lacking some perspective or training or more comprehensive understanding that sends them off on the wrong direction?
That's a really interesting question. Certainly people come with our basic American mental model is that research is looking things up, right? And so, and with as it is much easier to look things up with the ubiquity of information online, right? Then of course people are going to feel more empowered and able to do that. The ads on TV, I don't know that I've got data or evidence on how that affects people's thinking about their medical confidence or their medical knowledge, but it certainly enhances people's attention to side effects, right? Because they
Yeah.
are by regulation, right, have to disclose them. And I have wondered if that constant attention to side effects has actually played into vaccine skepticism and hesitancy overall, because it's made side effects a much more real and tangible part of people's thinking about anything that we put into our bodies.
I think that's such a great point. We've all had the personal experience where we hear the side effects and we turn to our loved one or a friend and say, gosh, I'd rather not have all the side effects than be afflicted by whatever the drug is
Yeah.
intending to cure. Let me shift slightly, but only slightly, to the nomination of RFK Jr. We all witnessed a powerful video that his cousin Caroline Kennedy put out talking about his role in spreading skepticism or simply untruths about vaccines. Talk to us a little bit about the danger of putting someone who is attracted to theories or who perpetuates theories that may not have scientific backing in a position of authority as someone who would run the entire Department of Health and Human Services would be.
So my reading of his rhetoric is that it's so often uh, based on a sense that we've lost control of society, right? We've got a runaway food system, a runaway pharmaceutical system, a runaway environmental protection, our environmental pollution is runaway. And of course, there are lots of genuine critiques in each of those areas to be made. But the rhetoric that he's using and the way he constructs his arguments are really heightening and tapping into this mental model of the threat of modernity, that social conditions were safer, simpler, and better in the past, and that because new ideas or technology or social arrangements are new, they're probably dangerous, and we should approach the future with kind of extreme fear and caution. And that is one way that we can think about the future, but we also can think about progress, and we can think about a more balanced way of thinking about the future. And so in putting someone who's uh, if a person who is constantly worried about progress and wants to return to a mythical past when things were supposedly safer and healthier, putting that person in charge of an agency that a good bit of their work is about advancing science, advancing knowledge, and certainly acting on that knowledge, there's a real disconnect there between the leader's mindset and the what has been the role of the agency. So I find that troubling and problematic.
When you look at medical progress, in the past, medical practitioners did all sorts of bizarre things to our modern eyes. They used leeches, they bled people, they had all of these crackpot schemes. It seems somewhat incredible that people should say, we don't want modern science. We don't want the progress in curing disease. We don't want increased longevity, all of the things that make it so much safer and enable us to live longer lives in the modern era, to go back to a time where people were sicker, less healthy, we had higher child mortality rates. Who would really want to go back to that?
I mean, I think it's right now, I think what we're seeing in our work at Frameworks and looking at trends in American culture is that Americans are having trouble imagining a positive future, period. And so that way of thinking, right, very easily leads to nostalgia, even with, looking through rose-colored glasses. Um, the other thing is it's really, I don't think that people are saying we want to go back to a time when people were sicker, right? I think that what people are saying is we have a sense that the system is being rigged by the powerful few at the expense of the rest of us. And we don't want that. And we have seen in our research that that's, like over 70% of Americans believe that the system is rigged right now. Who they fill in, who's doing the rigging and who's benefiting, and who's being harmed or oppressed by that rigging certainly varies by political party, by gender, by age, all those sorts of things. But it's a pretty widely shared mental model. And so people are rejecting that. They're rejecting the sense that our institutions aren't working for us, the 99% or ordinary Americans or whatever you want to call the big vast us. And I think that's where a lot of that is coming from.
So, what is the linguistic, the public education element that can help give people more confidence in the progress of science and be more willing to accept good information and reject bad information?
Oh, such a good question. Thank you for asking that. I think that whoever the messenger is, it's important to demonstrate care and concern along with any expertise, right? And so taking steps to build trust, to actually, one must actually be trustworthy as well. But doing a little bit extra to show through your affect, through your choice of words, through the anecdotes you tell, some of that personal relatability. I think it's interesting right now with some of the nominees. There's a sense that government is this nameless, faceless entity, and we put in a television celebrity, right? It's not a far step from that somebody I know to that somebody I trust, right? So that's part of why some of these unorthodox nominations, I think, are not being widely kind of rejected or questioned. So first thing is use care and concern to build trust. We need to be very clear and simple. We want to assume that our audiences are smart. We never want to talk down to people, but we also need to assume they know nothing about this issue, right? As if it's brand new. And so that calls on us to do the hard work of making things easy to understand. And then once we have the affect piece, right, of being a clear and compelling and engaging communicator, and the clarification piece of really thinking about what do we need to get through and what's the best way to do it. At that point, we need to repeat, repeat, repeat. It's really hard to break through a noisy world in general, a chaos of this type of news cycle that we're in. And if we are not really taking intentional efforts to get good information out there, we are ceding the public discourse to the folks who are repeating bad information quite effectively.
So, let me close with this. There are certain people in general who have higher levels of trust than other people. It seems that the people who are closest to the patient, closest to the individual, whether it's a doctor, whether it's a local official, have more salience with them than, as you say, some big impersonal government figure. Tell us a little bit about the level at which we can communicate good information and the importance of people who are closest to the patient, closest to the American people.
Yeah, I think the role of a trusted messenger is someone, that's a specific, the term gets thrown about a lot, but really it is somebody who has built a trusting relationship, right? And so, in our partnerships and our work with the American Academy of Pediatrics, the pediatricians are among the most trusted sources of information for children's health and all kinds of anything to do with kids, really, right? When we worked on oral health, we found people don't trust dentists, but they do trust school nurses, right? And so that was a more effective, type of messenger. And so really it is true that somebody who is seen as having the baseline of expertise, but also the ability to say, I care about you because I know you, right? I know this community. Lots of projects in public health make excellent use of what's sometimes called promotores or community health workers, right? People from the community. They've known them forever, kids played on their stoop and all that sort of stuff. And now they are trained up, right, to be one of those sources of information. So I think that there's that sense of closeness is important. And it's something that we're losing, right, in this digitally mediated age. And so I think that even heightens that the role of that type of communication.
Well, thank you so much for coming on. I fear that this is going to be a topic that plagues us for a while, and your expertise is going to be badly needed. So we hope you come back and join us and share your work and your insights. Thank you so much for joining us, and we'll see you soon, I suspect.
Thank you for having me. I'd love to come back anytime you think I can prove useful to your thinking and that of your audience. I appreciate it.